Department of Biotechnology and Medical Engineering of National Institute of Technology, Rourkela, was established in the year 2007 with the future goal of producing quality engineers by offering multidisciplinary teaching and research, developing world-class resources, and in making outstanding contributions in the realm of biomedical and biotechnology, a goal it has been achieving at a rapid rate. The department is divided into two streams, biotechnology and biomedical. There are six academics and research groups. Currently, a cadre of 10 faculty members from diverse fields have been appointed for carrying forth the department. The department is MBA accredited. We have various state-of-the-art labs too. Cell and molecular engineering, achievements of the department include Center of Excellence in Tissue Engineering and Orthopedic Tissue Engineering and Rehabilitation, DBT Program Support in Tissue Engineering, Program Support in Bioinformatics, DSF FIST Level 1. Bioprocess Engineering, Agricultural and Environment Engineering,
more beyond academics and fulfill the mission to combine biology with technology. and make it accessible for the benefit of society.
During these pandemic times, we have conducted many technical of years, especially in recent times. That's why we thought he has 21 years of experience. His specialties and interests include colon and rectal surgery in the field of liver, pancreas, gallbladder, spleen surgery, and gastric surgery. He is currently the chair of robotics and division head of esophageal surgery at Multicare Tacoma General Hospital. There are much to say about Sir, but by now everyone must be eager to hear from him directly. So, without any delay, I invite Dr. Prakash Gatta sir to take over the screen. Sir, please.
Well, thank you very much for that very kind introduction. Can you hear me?
Yes, sir. Yes, sir.
Okay, good, because I switched the mic in between, so hold on. Hopefully you could see my talk. Can you see my? Can everybody see everything here?
Yes, sir.
Okay, because I can't see you. One second. All right. So anyway, I just wanted to have a little disclosure slide. The disclosure basically is there's some of the companies that I consult for. I apologize here. Hold on a second. So Intuitive Surgical, the main product here is they make the robots, the currently available robot. Hold on a second. And then Johnson & Johnson, which has several other subdivisions and other companies that I consult for. So a little bit of background on me. I'm originally, I was raised in Kuwait. I did my med school in India. I finished a couple of years of high school in New Delhi, so I speak fluent Hindi as well. But arrived in the U.S. around 21 years ago and did my surgical training, residency, as well as fellowship within different parts of the U.S. My first job was in Cincinnati as an assistant professor of surgery at the University of Cincinnati. And I've been in the Seattle area over the last 10 years, 11 years now. So just wanted to go over some quick definitions. First of all, what does surgery mean? Surgery is the treatment of injuries or disorders of the body by incision or manipulation, especially with instruments. So in other words, it's controlled tissue trauma. What is a robot? A robot is a machine designed to execute one or more tasks automatically with speed and precision. And what does robots and surgery mean? The goal here is that surgery is done with precision, miniaturization, smaller incisions, less blood loss, less pain, and faster healing time. But one of the things that's important is it's not autonomous. So it's not truly a robot. It's not operating on its own. It needs to be given instructions by the surgeon, typically at the time of the operation, and it's used as a tool. and it may be a tool with better precision and miniaturization, but it still doesn't work on its own. And what is artificial intelligence? It's a buzzword today. Everyone watching, as well as all of the kids at your engineering school who are going to go out into the real world very soon, are going to encounter the term. But what does it mean? So it is the theory and development of computer systems able to perform tasks that normally require human intelligence. In other words, it is an augmentation of intelligence that we may normally have, the machines may normally have, but the application of which mimics or essentially replaces the function of a human being. Maybe artificial intelligence is the answer to fatigue, to sleep. So if you're watching something, flying a plane or in a spaceship, and you need something to function all the time, there may be something such as artificial intelligence that actually saves human lives. So they may have a role, either good or bad. This is a picture, this is actually a video of an operation that I am doing. So this, I know you guys are engineers, but I'm a surgeon. This is me closing the hole in the diaphragm from a patient who has a hernia where part of the stomach has sort of slid up into the chest, the inferior vena cava, the aorta, the heart, they're all pretty close here. And I'm using a particular stitch that is allowing me to close this defect. Now, the goal here is to perform this procedure safely without injury, but also do it fast. I've actually accelerated the video here. I'm operating at 3 to 4 times, the video is 3 to 4 times normal speed. But the point is if we were to enable technology or the robot to perform this procedure the same way as a human being would, in other words, copy what I just did, and do it in such a way that is done safely. Is that the answer? Maybe the robot can operate faster. Maybe it knows every move already, knows where anatomy is. So the need for robotic surgery is to provide better visualization, magnification, stability, tremor elimination, etc. Also reduce costs over time. And in the US, there's a huge issue with opioid use. You use opioids or narcotics like morphine, oxycodone after surgery, and the addiction of which is a huge problem within the Western world. And also to reduce complications. So maybe the robot is a tool to allow me to operate in such a way that allows me to operate faster and with reduced complications. This is my own data over the last 5 to 6 years of this one particular procedure that I showed you, and showing a reduction in the operative time. Same for the mean length of stay, around 89 to 90% of all my patients in this particular procedure will go home within 24 hours. We're pushing that to under 1 day, so 74% will leave on the same day. Now, why does reducing costs, why does that matter? Why does reducing complications matter? How does it affect costs? Here's a publication that talks about that. If you have fewer complications, the cost to a system is less. It's very simple. So if you were to say, look, the difference between a major complication and no complication after the same procedure is $24,000, for example, and you were able to avoid 100 such complications in a year, that pays for the cost of the robot or whatever other technology. So the technology enables you to do a safer operation and therefore reduce costs to the system. The other thing to note is, as our populations across the world increase, the impact of a number of surgeons that will be available to provide care to patients is going to reduce. As in the population grows, you can only squeeze out a certain number of medical students or surgeons every year. They're not enough. So how do we use technology to broaden the access of that curative intent? Robotics and artificial intelligence may be the answer. Now, the idea of this particular robot came out of DARPA, which is the military research wing of the U.S. Army, and they invented the GPS, and they invented the internet and a lot of other things that we take for granted today. And they also were tied into something called the NEMO missions. So this is the deep space missions. These are underwater missions where we use technology to see if it can be used in deep space. So we created a lab. We also created a space where a robot could potentially work in weightless conditions. We simulated weightless conditions in what's called the vomit comet. The plane, it goes up and it goes down towards Earth and simulates weightlessness for around 20 minutes. And we use a robot as well as a human to sew in that space. Is it possible to operate in space? There's also the concept of the trauma pod, SRI, which is sort of the branch of the original technology. This is a platform which is in one of the original versions of the current intuitive robot. And they built this pod, or sort of enclosed space, where an operation could be performed on a patient, fully automated, no human beings, but you have a human being as a patient in the middle of a war. So a lot of the tech research will come out of military spending, which is unlimited, at least in the Western world, at least in the U.S. And that allows for human inventions that can change the course of the human, the experience, so to speak. The ultimate goal being surgery in space. So how do we enable the currently available hardware with software that might create artificial intelligence to remove Elon Musk's appendix as he's on going to the surface of Mars? Remember, there's a 20-minute uplink delay. You can't really do a live operation. There's no surgeon that might be flying out into space. This is the solution, and we have to figure out how do we get there. Now, robotics today is multiple companies. There is a company called CMR, which is based out of the UK, but did its first human cases actually in India, in Pune. They're fast generating a lot of interest. There's a lot of other companies, but there's going to be consolidation over the next few years. Only one or two or three companies will exist. Da Vinci or Intuitive is the main player at this point, but other players like Medtronic and Johnson & Johnson are also very much involved. Everybody can still hear me? Just want to make sure.
Yes, sir.
Okay, great.
Yes, sir.
So one of the things that the current technology allows us to do is intraoperative data collection. So this means you're doing the operation, but the robot is constantly assimilating, pulling in technology as well as, pulling in anatomic knowledge. Where's the bleeding? What is the distortion of the anatomy? There may be a time not in the distant future where there's live disease evaluation. You're operating and you're able to see where the cancer is based on a certain dye or magnification. Intraoperative image recognition basically means anatomic recognition, and this is pattern recognition. So just like you have face recognition, and there's a lot of information on that, every face being unique, the tone of the skin being very unique. Why can't we teach the technology to recognize where the blood vessels are, where the stomach is, where the colon is? The answer is we can. And the ability of technology to recognize permutations and combinations of different images and to sort of apply that towards the motor function of the robot, as in what's controlling the robot, we're pretty close to accomplishing that goal, where the information given to the robot can be crunched and processed, and an end effector or motor, the actual instruments, can be used to fix the problem, remove the cancer, or fix the hernia, etc. So there's other applications here, which is the robot being used as a tool to evaluate the quality of the surgeon. How good is a surgeon? How efficient was he or she when they were moving the instrumentation? How quickly did they proceed between different phases of the procedure? How much blood loss was there? So the robot I'm using this technology to make me better, but it needs to make me better by providing feedback, and that those pieces of information do exist. And there's something we've heard about machine learning, which is considered a component of artificial intelligence. Machine teaching is a term that I like, where we're providing guided dissection, as in similar to lane departure warning when you're going down the highway, blind spot monitoring, etc. The point is that the robot can use the technology available to it to guide the surgeon, especially a younger surgeon with less experience, as to where to cut, where not to cut, where is the blood vessels, etc. It's a way of saving lives, protecting and reducing complications. The motor functions we know, which is something the surgeon today controls, the articulation of the instruments, like you saw in the video, three-dimensional camera, triangulation, as in the camera in the middle, left and right arm come together and perform the procedure as you would from an open surgery. But there are sensory functions that we have not fully capitalized on, which is the thickness of the tissue and haptic feedback, which basically means when you don't touch the patient yourself and the robot is touching for you, you're losing the sense of proprioception, which is your eyes are closed, and if somebody puts an apple in your hands, you know it's an apple or a banana. That's called proprioception. Your brain is able to process something without touching it, without seeing it, that is. That's what haptic feedback is. And haptic feedback exists today, and it is going to be brought to the surgeon's hands as he or she operates. There is real-time pathologic evaluation and also looking at the blood supply and tissue viability, which means you remove a segment of the stomach or the colon, put it back together. We need to make sure that tissue is alive for it to be able to survive and the patient to survive. Otherwise, you have complications such as leaks. There's things like memory functions, which is simulating the procedure the night before and playing it on a video on your phone or the surgeon's phone to know, and that's specific to that particular. I hope you can. So this is
Yes, sir.
a robot called a company called Boston Dynamics.
Yes, sir.
Just watch the video, and I want you to think about what the most amazing thing about this video is. Okay, I think you get the gist of what I'm trying to do, what I'm trying to show you here. Hold on. So I want you to think, we can talk about this later, but I want you to think about what you took away from that video. Is it the fact that the point is that we're not going to have robots using artificial intelligence to operate tomorrow. It's an incremental process where slowly, as the surgeons and the trainees phase out and the new generation of surgeons come in, they will be more accepting of technology. I may want this robot to operate on me tomorrow, but 99% of the surgeons will not. The point is, how do we utilize the tools available to us in such a way that doesn't scare patients away or surgeons away? You have to make it an incremental process, very similar to what Tesla may have done when they first released their car 9 years ago now, 2012. And slowly they have increased the amount of driver assistance and partial automation and ultimately going to full automation. Of course, they've moved much faster. Surgery is different, but the point is the concept will still exist. It's very enlightening paper. I think you guys should look at it in terms of what the sort of the story will be of surgery ultimately. So Um, and this, the paper also looks at various different sources of how you train an untrained robot into a fully trained robot using machine learning algorithms, simulating videos, surgical videos, explicit programming. That means you would code the robot, you would sort of input code into it and tell it what to do to perform a task. Or what you could do is watch me operate, download the code from the procedure I just did, and then sort of upload it back into the next procedure, for example. It doesn't always work like that, and there's multiple permutations and combinations, but the goal is that this is one way to utilize the brain power that exists today. And we are bringing together the ability of artificial intelligence and the hardware that exists to create a solution to a problem that we don't have yet. The definition of autonomy is the ability to perform intended tasks based on current state and sensing without human intervention. So that day, as I said, through an incremental process is arriving where we are able to fix this, solve this issue of human imprecision and fatigue in order to perform a surgery in an elective setting, most likely. So the future of surgery is speculative. There's a lot of different things that get into play. I've laid out what I think the pathway will be, and what the future might look like. And if you ever read an author called Isaac Asimov, a very influential author from he was originally a Russian immigrant, fled to the U.S. during World War II. A prolific author, wrote a lot within 10 years, maybe as early as 5 to 6 years. I think or maybe sooner. I do think that the first fully automated procedure will be done.
Thank you, sir. And we have another question from Om Saswat Sahu. Can AI in healthcare help in cancer regression? Or let's say AI helps in recognizing tumor cells and normal cells?
Yeah, that's exactly one of the concepts that's being looked at today, where in the midst of an operation, as opposed to taking a biopsy and sending it to the pathologist, there's at least a 20-30 minute delay there. Is there a way that the robot can recognize microscopic anatomy, as essentially histology is what we call it, magnify by 10,000 times and look at the cell structure of that particular cell, and using image recognition, is it able to recognize the presence of cancer cells or the absence of cancer cells? So I think artificial intelligence as a tool is going to be very helpful for our pathologists. And eventually, I think will make fields like pathology and radiology redundant. I think the artificial intelligence will, because these are essentially image recognition professions, right? If I was a radiologist, then I had 50 years of experience, I've seen every X-ray possible, but you can upload the brain power of that radiologist to the artificial intelligence platform today and allow it to make diagnoses correctly.
Thank you, sir. And the next question is from Hajira Naushin Zubair. Would AI help in decreasing risk of dangerous surgeries? To what degree?
Yeah, that's the point. Is it make the surgery safer? Perhaps it will by building guardrails, as in the robot recognizes that there's blood supply or removing or dividing blood vessels is going to sort of kill tissue that you don't want to kill. It may be able to prevent that and sort of teach the human being. It may be able to teach the human surgeon what not to do. So these are called guardrails, and it's created essentially as a way to protect the patient. So I think that technology is an enabling technology. It's very similar to, you know, uh, the beep you hear when you hear the elevator come. So it's a warning sign. Or when the door is left open in the car or light is left open, it's a warning sign to the people around you. These are small things that we take for granted. It's a very similar concept that just hasn't really existed in surgery because we feel that the surgeon should know. The truth is everyone's training is different, and when you start out as surgery, as a surgeon on your own, as many tools as possible will be very helpful.
Yes, sir. And we have another question from Shishir Khanal. Will it be possible to build artificial consciousness in the digitalized structure of artificial intelligence?
Well, that's a very incredible question. I don't know. So, first of all, I would be afraid of that because I don't want. If you read the book 2020, what is it called? Hal the robot up in space, and then he sort of kills the astronauts that are up in there. Forget the name of the book. I'm blanking. So anyway, so the point is, maybe we don't want to build a consciousness where some artificial intelligence platform can essentially, without the presence of human empathy, perform tasks or do things to the human race that we have no control over. So I'd be worried about that. However, I'm sure personalities will be built into AI concepts. So if you walk into your household and you have sort of an AI welcoming you, maybe it's in the voice of your grandmother, or maybe it's the personality of your daughter. We don't know. So I think we can build personalities. How safe is it going to be for it to think on its own completely without the sort of guidelines and the control of the surgeon present in the room? I don't know what that means actually, but I'm sure people are researching and looking at it. It's an interesting question.
Yes, sir. And we have another question from Om Saswat Sahu. Can we fully rely on robotics for surgery, let's say in the near future?
I don't know. See, here's the thing that, look, I went to med school in Bombay, big the King Edward Memorial Hospital, KEM, big public university, 3,000 beds. Most of the people who came to our hospital in Bombay were from all over the country. So, I mean, it depends on, are you providing care in a mass scale to the whole world, to the poor, the rich, or is this technology that should be only available to the super rich?
sir. And we have another question from Shashwat Mishra. How exactly is machine learning different from machine teaching?
Machine learning, I think, so I don't understand the concept like other people do. So I've had discussions with people who defer in my knowledge base. By machine teaching, I basically use that as a term because machine learning is overused. Machine teaching basically is the machine protecting the patient by teaching the surgeon what is safe or not. And in other words, so let's say the surgeon has operated for 100 years and somehow you could freeze his or her brain and provide all that knowledge to the robot, right? And then I come in as a surgeon doing a surgery and I'm about to do something that I'm not supposed to. The technology would hopefully use the knowledge base of the surgeon who's already gone and allow me to provide to do a more safe procedure. That's what I mean by machine teaching. So machine learning, a completely different concept, which is essentially the way the artificial intelligence platform teaches itself how to play chess or how to perform surgery. So different concepts.
Yes, sir. Thank you, sir. And we have another question from Shaurat Fatma. What are the different startups that can be started or are already there in the field of AI in healthcare?
Everybody on this call can do a startup. The point is, so there's many startups, and many of them will fail. But even if you were part of a startup that failed, you would learn something. So think of me. I'm from India. I grew up partly there and partly in the Middle East. Now I have the ability to talk to all these companies. They come to me. They ask me for ideas. You never know which one of you is going to be out there with the right ideas at the right time. There's a lot of luck involved in life. I'm many years older than all of you. You guys are kids when I look at you. The point is that the startups will exist from an idea that is sparked from this conversation, right? So I want you guys to go back, think about how you can or cannot influence the world. The truth is you can, and come up with ideas that may be unique, that may fit in to this unique niche where no one else is doing it, and then things will start to happen. You connect with the right people, go to the right conferences, you'll find funding, and you'll create the startups. And I think that is essentially the immense brain power that you all have is going to be best utilized by something that you're passionate about. If you work somewhere where you are one amongst 100, that's going to be killing for innovation. So you should always look for ideas, create them on your own, and then find ways to make it real. It'll happen.
Yes, sir. Let's hope so. And we have another question from Ramdun Yugesh. How fast will a robot respond when there is a complication during a surgery?
Very
Or
good.
there is a point where human doctors need to take over?
Yeah. So as far as for the foreseeable future, the surgeon or the human doctor is always going to be in the room. I think the concept of surgeon not even being in the room, uh, the way medical licenses and privileges and credentials work in all over the world, India, the U.S., you can't not be in the room. The argument is the robot doing a better job than you? Is it able to mimic the best knowledge base of every surgeon on the planet and perform the best procedure and reduce complications? But the surgeon will have to be there. It's very similar to the autopilot of the plane, but yet every commercial plane has two pilots, right? Because if something happens to the autopilot, the main pilot, Chief pilot takes over. If he has a heart attack, then the co-pilot takes over. So you have to have fail safes and backups. So that's not going to go away for a long, long time.
Yes, sir. And we have another question from Vipul Devastale. Which type of clinical operations are best suited for AI today?
So there's a huge amount of AI being thought of or utilized in, in data entry, electronic health records, electronic medical records, and also in prescription of medications, recognizing disease sets, things like that. Those are sort of some of the current applications that are of great interest. But there's also it is with the presence of a robot, AI is being now considered strongly in the field of surgery, and that's, I think, the big sort of exciting next frontier.
Yes, sir. And we have another question from Anubhav Srivastava. At what extent can we trust robots in situations which needs immediate action or situation of dilemma?
Yeah, so in trauma-like situations, non-elective surgery that is not planned, I don't think robots will have a role yet. That was the original concept of what's called a trauma pod. It's not like the trauma pod is deployed all over the world yet, so I think there's still some work to be done in emergency situations. So I don't think that's the role today. I think the human being needs to still be there in trauma like emergency situations. And I think he has another question he wrote in the chat box.
Yeah. Yes,
I
sir.
do. Okay, so the question is, can robots develop feelings, empathy, sympathy? I think those can be programmed into it. Is it going to organically know how to have feelings? I don't think anybody knows that. The scary thing about artificial intelligence is it learns from us, and it learns pretty quickly just because it has the processing power to do that. I think some caps need to be placed on its ability to sort of become a living being. So, yes, we wanted to develop sympathy and empathy. If you have robot cops or soldiers and it sees a baby, it should be able to recognize this is sort of a non-combatant, etc. So I think there's some things that guardrails we need to program into it, and in such a way that that can't be removed.
Yes. And next we have a question from Hajira Nausheen Zubair. How much of human support is required during a robotic surgery in today's scenario? And how many people have to be present during the surgery?
Good question. So today's robotic surgery, not automated, where I'm the surgeon controlling the robot, there's typically two, three, four additional people in the room in addition to the patient. So at least five people or more, plus the patient in the room. That's what we anesthesiologist, circulating nurse, bedside assistant, second bedside assistant, and then the surgeon, and then the patient, and then the robot. So 6, 7 people.
Okay. Any more questions from the audience? They can feel free to post it in the chat box right now. If there are any more questions, then we can continue on to the vote of thanks session. Any more questions from the audience? Okay, we have a question from Anubhav Srivastava itself. What if it learns some really bad things we humans have and robots implement it?
Well, so just like I said in my talk, the laws of robotics need to be sort of incorporated into the brain of the robot, which is we don't want the robot to cause harm to human beings. So we have to create guardrails within this entity that we are inventing in order to not do harm to us. So that is something we have to be very careful about. Yes.
Okay, sir. I guess that ends the question and answer session for the webinar. And now over to Aditi.
It was indeed an informative session. Thank you so much, sir, for being with us. It seems everyone over here want to express appreciation for your inspiring presentation. Now I request our Vice President Pritimai Senapati to deliver the vote of thanks. Over to you, Didi.
Thank you, Aditi. I on Thank you, Aditi. I, on behalf of Genesys, would like to convey our thanks to everyone who is present here, especially our speaker, Dr. Prakash Gatta sir, has taken his time out of his busy schedule to join us for this webinar. This pandemic has taught us about the importance of advancing in the bioengineering field, especially since it is interdisciplinary, and also every other field is important. We thank all the viewers from different fields watching us now. Thank you all.
Thank you.
Thank you, sir, for joining us today.
So we are grateful for the time and effort